dismiss history at our peril.
Liberty Nation Radio with Mark Angelides.
And you're back on Liberty Nation Radio, head coast to coast on the Radio America Network. I remain your host, as always, Mark Angelides. And we're joined by Liberty Nation's editor-at-large, Mr. James Fite. How are you, Jim?
Doing all right, Mark. How you doing?
I'm not bad. You've really been chasing the news in recent days, but I guess that's partly because the news has never really been quite so forthcoming and so unwieldy.
You know, the news runs, you chase it, I guess.
Yeah, you have to. Not like Max Headroom, because that turned out badly for him, as we discussed earlier. I knew that factoid would come in useful at some point.
That's it.
But yeah, everything seems to be moving at a shocking pace in the news world, which means that stories have to be carefully picked. Where do you spend your attention budget? And Jim, you cast your attention budget towards the TrumpRx, that without much fanfare, to be quite frank, fanfare, launched this last week. And now TrumpRx is an initiative, I think the president came up with it in September of 25, or announced that it would be forming in September 25.
Yeah.
And is now live and up and running. Could you give us the breakdown of what it is, what it does, and why it's even in existence?
Yeah, sure. So let's start with the why, I guess. That's kind of the beginning, I reckon. A lot of people don't think about medicinal costs because their insurance covers it, whether that's insurance that you pay a ridiculous monthly premium for, or Medicaid, Medicare, or whatever, which the American taxpayer pays a ridiculous price for.
Congratulations, American taxpayer.
I know, right? But anyways, all around the world, a lot of other countries are paying nowhere near as much as what Americans are paying cash value for a lot of drugs. And the TrumpRx website highlights some of those. And I did some independent research where I actually went and basically shopped for the drugs based on other countries and here. And it's all pretty, what I found was prices are going to vary from location to location, even within a country, but it's all pretty accurate that it's all within the range, what the website has posted. And what you can see is Americans do pay a ridiculous amount more for most drugs than most prescription drugs.
Yeah.
Than a lot of the rest of the developed world. And so what the president did was he negotiated these deals with certain pharmaceutical companies, Pfizer and such, and to where they will give us what they call most favored nation status. So we get better pricing on the drugs in return for being exempt from some tariffs. So, you know, it's
a quid pro quo.
It is. Yeah.
So this most favored nation thing, just to clarify that, because obviously I read your article on this, it's good to specify what that is. That doesn't mean that it's a comparable price to, say, for example, somebody in Kazakhstan pays for the medication, if they can even get it. It's developed countries' most favored nation. So it's the price that's available in developed nations. The lowest possible one is the price that Americans now get those drugs.
Right. And the direct comparison that TrumpRx uses is with Canada. So that's a good example.
It especially after Michael Moore bewitched a generation with his movie that didn't. I guess it hasn't really lasted the test of time. So this basically is a place. Operationally, I guess people go on. They look for the specific drug that they must have a prescription for. That's the key, right?
Yeah,
and they can then say they're going to do a purchase with it. They get a voucher to print or to show on the phone, and they can take that to a pharmacy, and then they'll get that for the price.
Right. That's ostensibly how this works. And I did try to. I called the Walgreens down the street, and they were like, "Oh, I don't know. You'll have to call corporate." And I was like, "All right, never mind." So, but best I can tell, that's exactly how it's going to work. That's certainly how they present it on the website, and as well, under each drug, you have the coupon that you can print or show on your mobile device,
right,
presumably, as well as a list of pharmacies that actually carry that drug and honor it. And a lot of it will just say most pharmacies or pharmacies that carry this. Some of it will say specifically this whatever location in this specific spot. I guess maybe some drugs are just not as commonly carried as others. Is probably what that comes down to.
Sure.
But yeah, and so you can get on this website, and it's a lot of it's hype. A lot of it's, when you hit the landing page, you've got a drug comparison with a chart that shows, the very first thing is I forget the drug that it's called now, but it's a fertility drug, and it's the average.
Go now.
Thank you. Yes. Yeah. Would if you were paying cash, you would pay like $1,400 per 450 IU dose.
Yeah.
And whereas in Canada you pay, I think it's like $300 or $400. And so now then it's got the new price is like 200 something. So you get to see this 90% saving, 93 I think it was percent savings. Most of the drugs the savings aren't 90 something percent. Most of them are around the 50 to 60% range, which is still not nothing, right?
Sure.
That's significant.
So there's a couple of aspects to consider here, isn't there? Because this, number one, is I guess that this most benefits people who would either ordinarily pay cash for their medication, right? Or people who get their medication through insurance, but then they've got to basically do a sum in their head, right, or on their computer, and figure out, is it cheaper for me in terms of my copay to get this through here? Will it affect my long-term insurance prospect? I mean, will it eventually bring down my insurance prices if I'm not using my insurance to pay for this?
That, I think, Mark, is one of the bigger things that a lot of people aren't really paying attention to right now. You mentioned a few minutes ago how this launched without much fanfare, and that was kind of on both sides of the aisle. You didn't see just a major explosion of news hyping it up from the right, and you also didn't really see a lot of hate from the left on it, which is kind of miraculous.
I noticed that, yes. Yeah.
A lot of the left-wing articles reported on it and said, hey, looks like some great savings, and then they countered that with talking about how a lot of your insurance companies are already getting deals like this, or in some cases better. And that's also true. But the difference there is this is a cash price that if you don't have insurance, you can just get this cash price. Whereas, okay, yes, perhaps your insurance company can get a better price, but you're either paying them a monthly premium, which you have to average that out and build it into the price of the drug, or you are, you're on Medicaid, Medicare, and the taxpayer is funding all of that. And then, of course, the copay issue, as you mentioned.
Yeah.
And I think that's the bigger issue, really, is that this could be, when I first heard about this, my first thought was, hey, this is a good way to cut out the middleman. Instead of giving all this money to the insurance companies and government subsidies to not just government programs, but private companies that provide insurance, we can cut out a lot of that, potentially, eventually, and save the taxpayers a ton of money. And we just don't tax the pharmaceutical companies quite as high.
Yeah, through the tariff.
Through the tariffs, yeah. So it's a shuffling. Like you're ending up with a pretty close to the same result, but the manner of how we're getting there is, instead of taking money away from people to fund this, we're just dropping all of the extra middleman stuff that cost extra money.
Yeah. Now, obviously, the majority of people in the United States have some form of insurance, whether that's Medicaid, Medicare, or private insurance through their work, or even just self-pay insurance, medical insurance. But that doesn't mean that everybody does. And I think that's an important aspect, because there are millions and millions of people who do not have insurance, right?
And there may soon be more, because we also have, if you go to the hospital, it's very expensive. But if you go to a walk-in clinic, it's usually like $100 a visit or something like that. And a lot of them will say, hey, if you pay $80 cash right now, you're good.
Yeah.
And that covers, you wouldn't go for like an elective surgery or something, but But you have an incident, you're sick, whatever, and you're able to get yourself to a hospital, not like call an ambulance incident, then you can do these walking clinics. It's much cheaper. They're, of course, also subsidized through taxation, but you can on the customer end, on the patient end, you can save money there instead of having this huge medical bill, which helps if you don't have insurance, of course.
Yeah.
And then so the other end of that is, well, now if I get a prescription from the walking clinic, perhaps I can get a better price, cash price, and I can just, I can get out of this whole rat race of insurance.
Yeah, it's again, this really does come back to that point about how that there wasn't much fanfare on it, but it currently, I think when it launched, I think there were 48 drugs on the register on the TrumpRx site.
40 something. I was thinking it was 45.
Yeah, 40. It's somewhere in there. Anyway,
Yeah.
More than 3 dozen, less than 5 dozen.
Yep.
So I guess that's a good range. But of course, obviously the plan is, I guess, for that to just keep going up as more come online for it. One thing I really noticed was that a lot of it was driven towards two things. One is, I guess you'd call them the weight loss drugs that have become so prevalent now.
And which we should point out were originally diabetes medication.
Yes, they were. And the fertility treatments, which the fact that these two things coincide so well with Donald Trump's overall agenda of get America having more babies and make America healthy again.
Right.
I don't think that's a coincidence. But we'll see if it ends up like most other government programs in the long run. But James, we'll be back with you after this break. Thanks for sticking around.
We dismiss history at our peril.
Liberty Nation Radio with Mark Angelides.